Researchers studying a range of long-term symptoms found 359 out of 1,655 patients hospitalized in Wuhan, China, suffered with hair. The findings, published in the Lancet, found that hair loss was a primary long-term symptom of COVID-19, alongside fatigue, shortness of breath, dizziness and joint. The authors of the paper, who wanted to investigate the long-term effects of the virus, say the symptoms remain largely unclear. The patients who were examined for this study had been discharged from Jin Yin-tan Hospital in Wuhan between January 7 and May 29, 2020 after suffering with COVID. 6 months later, they were interviewed again and presented with questionnaires that asked them about their symptoms and quality. They also underwent physical examinations and a 6-minute walking tests, as well as getting their 63% of the patients had experienced fatigue or muscle weakness, 26% suffered with sleep difficulties, 23% had anxiety or depression, and 22% suffered from hair. The NHS lists 14 symptoms of so-called long COVID. Some of these include extreme tiredness, chest pain, difficulty sleeping, depression, anxiety, pins and needles. Hair loss is not included in that list. Findings also showed that 76% of patients reported at least one symptom at 6 months after symptom onset, and the proportion was. The authors wrote, the aim of this study was to describe the long-term health consequences of patients with COVID-19 who have been discharged from hospital. To our knowledge, this is the largest cohort study with the longest follow-up duration assessing the health consequences of adult patients discharged from hospital recovering from COVID-19. Dermatologists say the hair loss is a normal response to a stressful experience, like falling ill with the virus during a pandemic, and that the hair will. However, it could be linked to conditions like alopecia, which in some cases can be irreversible. This follows an investigation published last summer by Dr Natalie Lambert from Indiana University School of. After collecting 1,567 responses from an online survey for former COVID patients, she found that 423 people had experienced hair loss. Hair loss was the 21st most common symptom from a list of 50. Dr. Lambert said, while the impact of COVID-19 on the lungs and vascular system have received some media and medical attention, the results of this survey suggest that brain, whole body, eye, and skin symptoms are also frequent occurring health problems for people. Top 10 long COVID symptoms. The Chinese Academy of Medical Sciences discovered a list of long COVID symptoms in their findings, published in the Lancet. According to the American Academy of Dermatology, AAD, COVID-induced hair loss is due to telogen effluvium, TE, a shedding condition caused by a disturbance in the hair. TE results in a high percentage of anagen follicles which are actively growing hair, going into their resting phase prematurely across the TE lasts somewhere between 6 to 9 months before hair returns to its normal thickness and appearance. It happens when more hairs than normal enter the shedding, telogen, phase of the hair growth life cycle at the same time. AAD. A fever or illness can force more hairs into the shedding phase. Most people see noticeable hair shedding 2 to 3 months after having a fever or illness. The Belgravia Center said 64% of male patients and 38% of women reported having long COVID. Raleigh Boshanova, superintendent trichologist at the Belgravia Center, said, it's quite common for TE-related hair loss to present around 3 months after a period of severe trauma, illness or stress, which fits with our. The spike in diagnoses shows the extent of stress that the virus places on the body, not only causing temporary TE, but also potentially exacerbating other hair loss conditions which can have long-lasting effects if left untreated.